name is Pat Wilkinson. Spent 26 plus years in the Marine Corps. Retired as a Sergeant Major. My last tour of duty was with Wounded Warrior Battalion West down in San Diego, detachment down in San Diego. Prior to that, I was the Battalion Sergeant Major for 2nd Battalion, 3rd Marines, which is an infantry battalion based out of Kaneohe Bay, Hawaii. June 26, 2008, I was in what they call a green on blue, where an Iraqi soldier had detonated a suicide vest and then wounded myself, one other Marine, killed 3 Marines, and 20 Iraqi nationals. Both my legs and then my whole right arm were wounded or injured. I was unconscious the whole time. Then I woke up in Landstuhl, Germany. I still had both legs, and they were trying to save them. I was medevaced to Bethesda, and then from Bethesda to Naval Medical Center, San Diego, where I took part in what they call limb salvage, where they tried to save both legs. And they were successful with the left leg. Unfortunately, about 9 months after being wounded, I developed a bone infection in the lower right leg, so they ended up having to take it above the knee. So as I was going through physical therapy, I started noticing or having more and more pain in my left leg as the muscle continued to develop as I was working it. And then one day when I'm down in C5, the physical therapy department down at Naval Medical Center, I was starting to go through a little bit of running, trying to learn how to run again on a prosthesis. And as I'm going down around the hallway, a couple of the doctors from dermatology had been speaking to the director of the physical therapy department, telling him, hey, you know, this is what we bring to the table, this is what we offer, and we'd like to, you know, have some of your patients come up and see us. And that's how I was introduced to the doctors at dermatology. And then from there, it was just a matter of, well, getting their brief, their presentation on what they thought they could do to help me. Because at some point, you don't want to hear, the word procedure to you means, hey, they're going to put me under, I'm going into surgery, I'm coming out in the PACU, in the recovery unit, and then I feel like garbage, you know, for the next couple of days. So the last thing you want to hear about is another procedure. Well, they tried to, you know, put my mind at ease about their procedure isn't exactly like that. Theirs is a pretty quick, in and out, simple procedure, but they wanted to see what benefits, you know, I would get from undergoing their treatment, right? And they thought they could help me, so that's how I was basically introduced to their whole program. I've had probably about a dozen laser treatments on the left leg, and then recently, within the last 2 months, I started receiving laser treatments on the right leg, on the residual limb. The benefits that I experienced from the laser treatment on my left leg, I noticed almost immediately. I told you that as I was strengthening my leg, as the muscle was developing, I was starting to have more and more pain in my left foot, and you know, it was impossible to get a decent night's sleep. Every 45 minutes to an hour, I'd be waking up, I'd have to massage the foot, and then you'd go back to sleep for another 45 minutes to an hour, and then you get up and do the process all over again. So I don't know exactly what was happening, and that's not why I saw the derm clinic. I just thought they were going to be able to treat the scar, and the fasciotomy scar on the left side was the one that they had started treating first, and they zapped me or treated me that day, and that night I had almost no pain in my left foot. So that was probably, you know, the first good night's sleep I had gotten in more than a year. I also started getting a little bit more range of motion. I was about 10 degrees shy of neutral, which meant that my left foot dropped. I couldn't get it up to 90 degrees. I couldn't get it flat unless I put weight on it. I couldn't do it on my own. Over the course of the treatments, I started slowly but surely getting, more and more range of motion. So now I am at neutral. I can get to neutral by myself. I don't need somebody to push on it, or I don't need to put weight on it or anything like that. I can do it all on my own. So that's after, going through a year of physical therapy, not being able to get to that point, and then the only thing that changed were the laser treatments. Right? So there's no doubt in my mind that they helped me get that little extra that I needed to. The impact that I've noticed the most, the scar has softened up quite a bit, and it's also made it a little bit more flesh toned. So it's not that angry red, or it's not that white, so it doesn't jump out at you as saying, hey, here's a scar. Now people, you kind of have to look to notice that there is a scar. Before, if you had looked at the scar, you could actually see what you would think would be the muscle strands, right, because it was adhered to the muscle that tightly. And as the number of procedures, as we progressed with procedures, it seemed like it kind of slowly pulled the scar away from the muscle, and now you don't really notice it unless I'm really exerting myself. Yeah, the initial, maybe half dozen procedures started pulling it away from the muscle, and that probably helped with the range of motion and the pain issue, because I don't know if the scarring adhered to the muscle was inhibiting blood flow to my foot, or preventing the muscle from fully working the way it was supposed to. But yeah, it's been phenomenal. I experienced no complications whatsoever. I mean, other than the fact that you can't, shower for a day or two after the treatment, which is more of a complication for my wife than myself. I had no problems whatsoever. I mean, there was, like I said before, every other procedure that I'd had since then, involved, recovery time and being stuck in bed for an extended period of time. Whereas this, it was, you were in and out. It didn't affect me being able to walk. It didn't put me back in a wheelchair. It was unbelievable, to be honest with you. It wasn't anything like what I expected or what I had conditioned myself to expect from a quote-unquote surgical procedure. It all comes down to normalcy. Right? If I can walk, like I used to, then I'm happy. If I can move like I used to be able to, I'm happy. My balance, it all comes down to being as normal as you possibly can. As far as the hobbies and all that's concerned, well, obviously I'm not running as fast as I could, and I don't play baseball as well as I used to. My side to side isn't what it used to be. But yeah, I mean, the only limitations are what I basically put on myself, and giving me that extra, 5 to 10 degrees range of motion. I mean, you don't think that 10 degrees is gonna affect you that much, but it does. It's unbelievable. Right? Just simple walking, going up and down the stairs, up and down a slope. Right? It's made it so much easier, and that's I'm happy with being normal. I had never really thought about hair removal on the residual limb side until I had actually been to this conference, the SCAR Symposium, Project CARE conference, and talking to the other Marines who'd been there, and they started getting the hair removal off their residual limbs, and they started talking about the benefits, and that's when I decided, well, maybe that's something I want to try. The benefits being, it helps with the sweat, and being stuck in a neoprene or rubber-coated sleeve all day, you tend to sweat, especially when it's hot out. So anything you can do to alleviate that, or decrease the amount of sweat, which also helps with the scarring on the limb, because once the salt and the sweat or whatever, it tends to irritate the scars. The other benefit, and this was probably the driving force for me, was getting an ingrown hair. Guys, I guess women get them all the time, all right? But guys, you don't think about it. but they're painful, especially when you're talking about on a residual limb, the prosthesis rubbing up against your leg all day, in your groin area and that kind of stuff. The pain was like, I was like, this is crazy. Well, the advice that I would give is, A, do your research, right, and then talk to people. Right? Talk to people, such as myself. Fortunately, down at San Diego, or unfortunately, whatever the case may be, is you have a pretty large population who have received treatment, so you have a lot of people to speak to. But then the big thing is, do it. My experience is there's no downside. It's in and out. It's nowhere near as painful as, anything else. All the other procedures that most of these people who have scarring or burns like they do have been through. There's no pain involved. The whole process is basically a local anesthetic with some numbing cream over the skin, and so you really don't feel it. And if you do end up feeling something, it's like somebody flicked a rubber band on you. So the pain is nothing, right? But the positives have been unbelievable. People wouldn't think 5 to 10 degrees is that big of a deal. It's a huge deal. The alleviation of the pain and getting a decent night's sleep, huge. Cosmetically, making it look more like the skin around it is, that's a big deal too.